Hello, my name is Dr. Tred Rissacker, and I am your host here on Dr. Tred TV. And today we're going to go over how to lose money with cool sculpting. Yes, cool sculpting. Right now, cool sculpting is the number one procedure besides liposuction that people are choosing when they want to do some body fat reduction or skin tightening or things like that. And my experience has been it's being misrepresented in many ways, and the type of people they can take care of, and who the procedure was really designed for is up to the providers to make those choices, to make the right decision when somebody comes in. There's a few things that have to happen with cool sculpting that have to be provided, and one is the machine has to be able to attach to the fat. And when it does, it has to pull the fat into this machine, which is what you see here on this picture. That's the machine, and it has to lay over the belly. And this plastic sheet protects the skin from being frostbit, but that can still not work. Now, this machine has to pull the tissue up into this machine, and then it squeezes it there. And it has to hold it there for up to 30 to 40 to 50 minutes. And thus, if your skin can't be grabbed and it can't be pulled into it, it can't change it. So let's go into a little bit more. There's some other issues with cool sculpting that are really important. One is you can't really have a body fat of over 25, 26%. You know, if you're 30% body fat, which is, 80, excuse me, 40% of the population is over 30% body fat, you're not even a candidate for cool sculpting. So that's another issue here. And it has to be repeated again and again to the same areas. And it can leave you with these hard lumps. So these are some of the things, and I'm going to go over it right now. I have it all, written out in a better way. So let's get back to to what I was going over. So you work hard for your money. So let's try not to throw it away. Non-invasive fat removal procedures are all the rage right now, and some can be very beneficial if you understand what they are, how they work, and whether or not you are a good candidate. So it's all about, am I a good candidate for this? That's the number one thing. Now, I'm a doctor of chiropractic, and I've been in the body sculpting weight loss industry for over 13 years, and I am a provider of non-surgical fat loss services. I've served over 6,000 clients in the last 13 years. Granted, I see the unhappy customers of some of these techniques as they come in to find out if my device can help. The machine I use is called the Lapex BCS Pro for body sculpting device. It's an FDA-cleared low-level laser, which can spot fat reduce and can also help as an assist with weight loss. So if you're really overweight and you need weight loss, we can help. If your weight is pretty good and you just want to get some skin tightening and some toning, we can help there without any possible chance of a burn, of a lump, no side effects at all with what we do. It should be noted that I have no interest in any other procedure besides my own. I would not recommend any of these things. Over the last 13 years, my procedure has been proven by me to be the single most effective outside applied process I have ever seen. There is no pain, there is no downtime, same day results, and the procedure can be done again and again without any danger of being overtreated. You can be incredibly fat with a BMI of over 40%, or you could be a super skinny mini with a body fat under 18%. My laser, low-level laser lipo, the Lapex BCS Pro, will always reduce subcutaneous fat wherever it is applied. Our program is 9 30-minute laser sessions in 3 weeks. Average inch loss is 3 to 9 inches of fat or 1 to 5 inches of girth, and that would be 1 to 3 pant sizes, 2 to 3 dress sizes, around the belly or anywhere the laser is applied. Chin, arms, thighs, back fat, bra bulge, love handles, muffin tops. We can treat it all with this laser. This is my attempt to share with you some of what I've watched, learned, and experienced about the value of cool sculpting, and also the hidden costs that are not well explained when going into a cool sculpting provider. So the first thing we got to talk about, what exactly is cool sculpting, okay? And cool sculpting is a body contouring treatment that uses a process called cryolipolysis. Now, that's not a great name for what it's doing. Lipolysis means to pierce a fat cell or a cell with a small opening, lipolysis. And that might be a needle. It could also be energy that opens up a fat cell. To destroy a fat cell is called apoptosis. So here's the first problem I have with cool sculpting. They're using a term called cryolipolysis, yet really it's cryoapoptosis because it destroys the tissue, not lipolysis. And they call it fat freezing, which is, again, not lipolysis. That's apoptosis. When you destroy tissue, it's apoptosis. They target stubborn areas of fat without surgery. The cool sculpting device freezes and kills fat cells without harming neighboring skin, nerves, vessels, or muscles. Each treatment usually takes less than an hour, and there is no downtime. Now, this is written from the manufacturer's website, so they're not going to tell you that there is downtime. In other words, you don't heal until 12 to 16 weeks after the procedure. You know, it's red, it's swollen, it's bruised when you first stop. How is that no downtime? I don't understand how they could say that. And also, it doesn't harm neighboring skin, nerves, vessels, or muscles. Every one of those skin, nerves, muscles has been hurt by cool sculpting procedures. Not everybody, but a lot. And the literature will show that. So that's really not true without harming. There's a risk of harming skin, nerves, vessels, and muscles when you do cool sculpting, and there is downtime. It is FDA approved for the abdomen, flanks, meaning the love handles, inner and outer thighs, bra bulge, back fat, under the butt, also called a banana roll, and upper arms. It's also cleared by the FDA to treat submental fat, commonly known as double chin, with a special applicator called the Cool Mini. Doctors also commonly use it off-label to tone knees, hips, and other fat bulges that fit into the applicator. So that should be a flag right there. It's only FDA approved for bellies and arms and back fat, as it says, inner outer thighs, yet they're using it off-label to squeeze into the machine knees, hips, and other fat bulges that fit into the applicator. Here's my list of questions, concerns before you prior to choosing cool sculpting. So here would be some of the questions I would ask right away. Number one, am I too fat for cool sculpting? Okay, what is that? What do I mean by that? Cool sculpting providers all agree that good clients are close to normal weight with no more than 20 extra pounds and a BMI of less than 30%. So you need to get a BMI, which is a machine that we do at my office, and it will give you your exact body fat percentage. In my experience of taking care of thousands of people, it is rare, I mean rare, to get somebody under 30% body fat. If they come in with less than 30% body fat, typically they're athletic, they're exercising, they're taking care of themselves, they're eating the right foods, they're probably on some hormone replacement if they're over 50. In other words, these people are not struggling with body fat. They just want to tone a small spot. You get over 30%, now you're talking obesity, and these are the people that have the big, large bellies that cool sculpting is not good at treating. It just doesn't. It can't grab enough fat. The problem is 80% of adults in the USA are considered overweight with excess fat of 25% or higher, and 30% of all adult men and adult females in this group are obese at 30% body fat. This restricts Cool Sculpting candidates to being in really good shape, younger in age, with a BMI under 30%. These great candidates only make up about 20% of our population. I mean, really, it's amazing to believe that, but it's true. I've seen clients who have come in to see me that have been recommended for Cool Sculpting who have enormous hanging bellies, huge thighs, hanging back fat, with BMIs of over 30 to 30%. And they are being told they are good candidates for Cool Sculpting, and they come in with the paperwork. That's how I know this. These persons are not good candidates, okay? It's not true. If you're too fat, Cool Sculpting is not for you. Since most Cool Sculpting providers do not give any money-back guarantee, you will be out of your cash if it does not work. So there's your first rule. You work hard for your cash. Hold on to it. If you're too fat, you are not a good candidate for Cool Sculpting. No matter what they tell you at the provider, save your money, join a gym, or consider either liposuction or someone who incorporates spot fat reduction using low-level lasers along with nutritional help specific for weight loss, which is what we're doing at the spa. Number 2, stick to the areas that are FDA cleared as safe and effective. The FDA has determined certain areas are okay for this machine. I suggest you stick to those areas. Anything outside of that could leave you at risk. So here's the areas that have been established as safe and effective by the Cool Sculpting procedure. By the way, let me just really quick show you a little picture of the Cool Sculpting thing. Submental fat under your chin. These are 9 approved areas. Under your chin, the inner or outer thighs, the abdomen, which is what you see here in this picture, the abdomen, love handles or muffin tops, the flanks, bra bulges, back fat, and fat under the buttocks called the banana roll. These are the only areas where Cool Sculpting has been shown to be safe and effective. Choosing any of the areas not included will most likely not respond to the procedure, and this will leave you out of your cash without any results to show for it. Also, since these areas are considered off-label, getting a refund or filing a malpractice claim will be very difficult since you went off-label for your treatment. Number 3 reason, most people need 2 to 3 treatments spaced up to 20 weeks apart so you can get the best optimal results. It's got to be done again and again. Now, you won't hear that. You won't hear much about that. Some will tell you, hey, I saw one sheet come through from a provider over in Traditions over there in St. Lucie West, and they recommended abdomen, flanks, thighs, and back. It was over $9,000 for the treatments. And then they recommended within, I think it was 2 months later, the same process at a second time, and they discounted it to like 7. So 9 for the first, 7 for the second. Man, that's almost $16,000 for Cool Sculpting. I mean, it's insane. We charge $2,800 for the whole 4 weeks, and we can do all those areas. So it's pretty expensive. So the cost for Cool Sculpting is between $2,000 and $4,000, depending on how many areas and how many sessions are needed. There are people who have spent over $25,000 to get the results they wanted due to the multiple areas and the repeat sessions spread out over 1 to 2 years. It is safe to say that you will need at least 2 repeated sessions spaced out every 2 to 3 months if you have an area that is particularly difficult to reduce. No one tells you this. They just keep on doing more and more until someone gives up or runs out of money. So 1 treatment is rarely enough. Expect 2, 3, and even 4 sessions to the same area. Number 4, The treatment sessions on large areas can be pricier than liposuction with less dramatic results. 3 sessions on large areas can be over $6,000 at Cool Sculpting. You could do liposuction for almost that same amount or less. It's a lot of money. Number 5, potentially permanent indentations or frostbite can occur if the protective pad and applicator aren't properly placed and monitored by the provider. Follow-up medical opinions and possible plastic surgical repairs will be paid for you, not the provider. So the protective pad you see here, when I bring this picture up, this pad right here, this plastic piece can be disrupted, it can be kinked, it can get away from the skin, and that will lead you to being burned or having frostbite or a permanent indentation from this procedure. Number 6, according to the Real Self website, members who rated the procedure not worth it didn't see much of a difference or had side effects like hyperpigmentation, which is dark spots, frostbite, burns, lingering nerve pain because it clamps down on you and freezes it, and something called paradoxical adipose hyperplasia, PAH, which is an increase in fat at the treatment site that leaves hard nodules and a lump under the skin. Now, PAH has been described in the literature for many, many years, right after Cool Sculpting began. And one of the issues that they ran into was when they told people about it, but they have to disclose it, they said the chances were like infinitesimal that you would have it. 1 in like 300,000 or something. It was really, really like, well, let's do it. I mean, my chances are slim. Then they find out it's like 1 in like 8,000. Now they're finding out it's even less happening. It happens a lot. And this PAH, or paradoxical hyperplasia, adipose hyperplasia, is left over after they apply this procedure, the freezing. It leaves you with a hard ridge lump, which doesn't go away and has to be surgically removed. This was Linda Evangelista, who was a very famous supermodel with Naomi Campbell and Kim, whoever her name was, that was all the other models. There was 5 of them that were super beautiful. She was in her early 50s and had the Cool Sculpting procedure and was left over with paradoxical hyperplasia around her upper arms, under her left arm, down in the inner part of her thighs. It was left with these lumps. She sued and won and got an enormous settlement from Cool Sculpting. They won't disclose it because she signed a non-disclosure, but I believe it was for over $50 million. So a lot of people have sued Cool Sculpting over this issue. It's not uncommon, but it does, I should say it's not common, but it does happen. So number 7 reason, others were surprised by sagging skin after losing the underlying fat. Usually it's a problem only for older patients with less skin elasticity. So following Cool Sculpting, you can be left with saggy skin. That's what they're saying. Number 8, studies show that 2/3 of the patients have numbness for up to 8 weeks after their treatment. They're still numb 8 weeks after the treatment. So nerves have been damaged. They have been frozen or hurt in some way. Number 9, paradoxical adipose hyperplasia, or PHS, is a particularly nasty increase of fat at the area that the Cool Sculpting targeted. So these are some of the questions you should be asking about Cool Sculpting, the provider. And I'm going to briefly summarize them here, just so in case you didn't listen. Being too fat, you want to be under 25% body fat, or be willing to just do one small spot. So you don't want to be too fat for Cool Sculpting. It doesn't work well. And since most of the adults are overweight, that puts out an enormous amount of people that are being treated improperly using this fat freezing procedure. Number 2, stick to the areas that the FDA have cleared as safe and effective. The chin, the thighs, the abdomen, the flanks, bra bulges, back fat, and then the fat under the buttocks. These are the only areas where cool sculpting has been shown to be successful. Number 3, most people need 2 to 3 treatments spaced up to 20 weeks apart to see optimal results. It's not a one-time thing. You got to do it again and again, and the costs can be $2,000 to $4,000 for the first round and up to $9,000, $10,000 with additional rounds. It's very expensive to really follow through with the whole process. Number 4, treatment sessions on large areas can be more costly than liposuction. Number 5, permanent indentations of frostbite can occur if the protective pad and applicator aren't properly placed. So that's number 5. Number 6, according to Real Self members who posted the not worth it, they saw hyperpigmentation, frostbite burns, lingering nerve pain, and paradoxical hyperplasia at the site of the treatment. Others were surprised, number 7, by sagging skin after losing underlying fat. Studies also show that 2/3 of patients have numbness for up to 8 weeks after their treatment. So those are some of the issues with cool sculpting. I hope you go in there with a open understanding of the limitations of it. And also, if you're concerned about being hurt and you're concerned about overpaying, you might want to give Slim Body Laser a call. We're using a low-level laser, non-invasive, non-surgical process, predictable, measurable. We give a 3-inch money-back guarantee if you don't lose at least an inch in 3 spots after 9 sessions. We picked the wrong person. You know, we give refunds. All of our plans include nutritional evaluation, food planning if necessary, detoxification supplements to help with getting rid of the poisons that are tied up in the fat. It also includes use of whole body vibration plates, which tone and strengthen your muscle core. They also help to break up fat and help you to prevent sagging skin. At the same time, you can become a member of our club. It's called the Alumni, the VIP Slim Body VIP Club, and that's a discount on future visits until as long as we're here and as long as you're a member, you can have those discounts. All right. I hope you enjoyed my talk. I will talk to you soon. And hey, man, have a great day. You know, don't let anything get you down. Just have fun and enjoy life. Life is to be enjoyed. Bye-bye.